from the PCTV studios in Pottstown, Pennsylvania on channel 28. You can also watch this show on your computer or a mobile device that you see at the bottom of the page. Just log into the PCTV network and click on what's happening and enjoy the show. Well, today I have my dear friend with me, and her name is Jody Daniels, and she's the Executive Director Assistant at Chestnut Knoll at Home. Right, Jody?
And for Chestnut Knoll, the building.
And for Chestnut Knoll.
In Boyertown.
In Boyertown. In Boyertown, Pennsylvania, for all you folks that are not in Pennsylvania, since this streams around the world. Okay, Jody, let's talk about things today. I am interested in learning. We have this flu breakout everywhere.
Indeed.
I have never washed my hands so much since my mother had me doing it as a child. And I think that might be the clue. What do you do for the folks over there living at Chestnut Knoll?
Well, we do many things, Dean. Certainly when you're in a community, you're exposed to many more opportunities to meet new bugs and people to be carriers, from staff to residents to each other. We all have to take care of ourselves. So we do a lot of education on something called infection control. The most basic and most effective thing is to wash your hands and to wash all sides of your hands. Remember, your fingers have 4 sides, not just the palms of our hands. And remember, a cute place to hide if you're a bacteria is under those rings we have on.
Oh.
So moving them and making sure the soap and water gets under there, and then they get dried as well. Some people say that you should hum the ABCs to know that you're washing your hands long enough with a lot of friction and soapy water and on all sides of your hands and under your nail beds too. Maybe taking your finger and rubbing it on your palm so your nail bed gets some washing as well.
You can hum or sing.
Okay. Yes, you can do it.
A, B, C, D.
That's right.
We know that.
Revisit your childhood.
That's right.
That's
and
right.
It makes it more fun.
It does make it more fun, and you almost entertain yourself and while you're there, and it makes the time go a little bit faster.
You forget you're doing something worthwhile. You think it's a fun thing.
Absolutely, and actually when you do it for the first time, sometimes you come to realize you really have not been washing your hands long enough.
It's like when you brush your teeth.
Absolutely.
You really don't do it long enough.
Right. So hand washing is the major way to prevent spreading disease and infection. We educate the residents, so we have a nurse that does education for the residents themselves so that we can all be in control of how we minimize the amount of time a disease affects us if we do catch a cold or a form of the flu or something like that. Some tricks are, I know the children in the schools are taught this now, but to sneeze into your elbow. Lift your hand and sneeze or cough into your elbow. That way it's not on your hands. So a lot of diseases and germs are from contact. So germs can be spread 2 ways essentially, either airborne, when somebody sneezes across the table and those droplets can go many feet and get onto things, or by contact from what we touch. So at Chestnut Knoll, we sanitize all surfaces several times a day. Walkers, wheelchairs, handrails, chairs, things that just people put their hands on.
Yeah.
Because you can go from putting your hand on it to touching your food and putting it straight in your mouth.
You know, I was in the doctor's office this week, and I didn't even attempt to pick up a magazine.
That's right.
You never know. And then everything I touched there. And then when I went home, I stripped my clothes. Because you pick it up on your clothes when you're in a seat. You don't know. You know how many times you touch your mouth that you're not aware of it?
That's right.
You are always touching your mouth, and it's amazing. Like if you're eating, and you pick up a germ while you're eating, and then you put a piece of bread in your mouth, you're putting the germ right in your mouth.
That's correct. That's correct. Then everything you've touched, without making everybody into germaphobes while we talk, but everything you touch then does go directly on that roll or bread and straight into your system.
It's like I said to you before in an earlier show, Jody. Those white gloves we girls wore in the 50s.
There was something to be said for them?
There was something to be said for that. Plus our hands were lovely.
Yes, that's right. So even though they're drying out from washing them all the time now, maybe if we'd add the white gloves, we'd get some moisturized hands again.
Oh, and you know what else? I bet your aides are using those
Hand sanitizer?
No, that and the elastic,
Oh, we do.
What kind of gloves are they?
The latex or plastic
that's
exam
right.
type gloves,
Yeah.
even non-latex.
Yeah, yeah.
And you know what's important too? We also, well, let me say one thing. So whether you're with sick people or not, one thing you should do is follow what's called universal precautions. That means always having these hand washing and these behaviors, even when the media is not announcing a flu epidemic. Always treat things as like they're potentially infectious. So when you're providing care, that's wearing gloves and changing your gloves, because otherwise your gloves just become like your hands are. If you just go from person to person, the germs are on the gloves.
So whenever you go to treat a person, then she'll wear the gloves, and she removes them when she goes to the next person or the next room.
That's right.
Or
Removes them and washes her hands, washes his or her hands, and or hand sanitizes if a washing station isn't available.
Well, I know when I go out to eat, I take that hand sanitizer with me, and I do that before the meal and after the meal. You know, another thing, using public restrooms, that's something, because you come out of the commode and you wash your hands at the sink, and then you're touching a door that a lot of other people have touched. You don't do that. You use your elbow or your shoulder to open that door.
That's right.
Little tricks.
Another little trick in the restroom is that you take a paper towel out of the paper towel dispenser to turn on and off the faucet. Because if you think of it, when you come out of the restroom and you go to the sink, your hands are dirty, and you're turning on the water and washing your hands, but then you're turning off the water with your clean hand that your dirty hands just touched the faucet. So using, or the knob to turn it on and off.
Boy, are we going to have clean hands.
We are going to have clean everything. We should be germ-free forever. But hand sanitizer, I know you have the most lovely smelling hand sanitizer, I must say. That's why I always ask for a little bit, even though I have my own in my purse when we're together.
Yeah,
but hand sanitizer has a very high percentage of killing bacteria and germs, and it's very convenient and it's very fragrant these days. So people should really take the time to use it.
When you go into places now, they sort of have one there for you to use, just like they have the Kleenex there for you to use in the event that so you don't spread your germs when you're blowing your nose, things like that. It's really amazing today how we spread germs. Well, there's more people.
That's right.
There's more people. Now, if someone gets the flu over there in your facility, do you quarantine them so that the other folks don't get it?
We do. We care for them in their rooms during that time. The residents typically have televisions and radios and things in their rooms, but we bring their meals to them and we provide them with extra support during that time, making sure they get lots of liquids. We go around the building a couple of times a day taking beverages, because staying well hydrated or drinking a lot really helps prevent a lot of problems in your body. And I mean drinking water, not drinking a lot.
Oh, well.
Although that might help too.
You never know.
If you're the one doing the care on sick people, that might be what you need.
They say drink a lot of water, but what about drinking juices? Apple juice, orange juice, any kind of juice.
I think it's
cranberry juice.
I think it's excellent as long as it's not something with caffeine or alcohol.
Oh, yeah. The caffeine. I can't take caffeine. I'm allergic to caffeine.
Is that right?
Uh-huh. Yeah.
Wow, always? Or is that something?
Yep, nope. I never drank a cup of coffee in my life.
Wow.
I drink decaf tea.
What happens when you drink caffeine? Do you go wild?
Oh, it gets me, ooh.
All jittery?
Yeah. I don't know how people can drink that coffee. They go, I must have a cup of coffee in the morning. I don't want to go there. I'm jittery enough. I do enough. I get in enough trouble without that. So I stay away from that, yeah.
The other thing that people should take notice of in their own homes and as they're going places is the surfaces. And there are a lot of hand wipes and mobile type things that you can get now, that Lysol wipes or any brand of the disinfectant wipes, to wipe the steering wheel of the car, or to wipe wipe down seats, just to get the germs away, and to use a hand sanitizer, certainly. And to throw those tissues away immediately into a trash can after they're used. Tissues, Kleenex, whatever you want to call them, are disposable.
Yes.
So they're really intended to be one use. And so sometimes people get a little conservative with how many times they want to use that tissue. And I recommend you keep a baggie in your purse, a Ziploc type baggie, even a small snack size, to put those used tissues in. If you're not near a trash can, just zip them up in a little bag so that you're not having soiled tissues getting on everything else in your purse as well.
Well, you know, that's a great idea. I've been wondering what I should do with them.
You can't always find a place to throw them
No.
away.
Yeah,
That's right. So I have a
that's
baggie
good.
in my car and one in my purse, just if you have something to throw away so it doesn't contaminate everything.
One more thing in the purse.
That's right. Well, the
Zippy.
little old tissue bag won't hurt. It smushes to any size, Dean.
I know. You're,
Yeah, yeah.
it's something else.
But diligence, you know, everyday diligence, whether you're sick or not sick, whether someone in your home is sick or not, we're all around each other, and some people don't
Yeah.
follow good infection control.
Yeah.
And so even when you're feeling well, following these precautions
Yes,
is a good idea.
That's a good idea. It's really getting into the habit.
That's right.
Get into good habits, good things to do for yourself.
And rest.
Yeah.
And stay away from people if you don't feel good.
Mm-hmm.
And so even if you have someone that you faithfully visit and you feel badly that you wouldn't be able to visit them, you're giving them a better gift by
do 'em a
just
favor.
waiting.
Yeah.
Yeah.
Jody, you have at-home services.
We do.
Right? Do you have a couple of offices?
We do.
Where are they?
We have one in Gilbertsville, Pennsylvania, right across from the Gilbertsville Shopping Center. Some people know it as the old Saul's location where TVs were sold years ago in Boyertown and Gilbertsville area.
Mm-hmm.
And we have one in Tarrytown Plaza right off of 724 in Phoenixville, right outside of Phoenixville.
Okay. And tell me, what services do you provide, and how is the flu epidemic with your at-home care people?
The services we provide are the extra support for people, whether it be long-term because they have a chronic disease that's caused them not to be able to make their meals, get their bathing done safely on their own, taking them to doctor's appointments, anything from many days and many hours to just during a period of recovery from illness. So we see that people now are calling to say, you know, my family member has been in the hospital, now they went to rehabilitation, or perhaps they didn't, but they're not just quite not up to managing the household.
Yeah.
Could you send someone in for 2 hours in the morning to help them get up and get their breakfast? And maybe then again at noontime to bring a meal, or dinner time at bedtime.
Mm-hmm.
So it gives a lot of family members, children of the folks that are sick, peace of mind to know that in addition to calling and checking on mom, or maybe instead of calling and interrupting her rest, you have somebody that's going to go in and actually see them and be there, offer them a drink, make sure they're keeping hydrated, all those sorts of things.
Okay, so you also would be able to help someone perhaps that is looking after their loved one, but they're on vacation
Yes,
and they're not around.
yes.
How do you keep in touch with those people?
A lot of times we keep in touch with the family members of those residents. Well, there's a lot of technology now. So I would say that many people that I work with now prefer email over the computer or even texting to telephone calls.
Mm-hmm.
But we ask what the preferred method of communication is and what time of day they'd like to be contacted and about what. Some people only want to be called if they're on vacation, if there's an emergency.
Mm-hmm.
Others, you know, are used to being the caregiver every day and they want to know everything that's happening every day. And we're here to meet whatever need they have for information.
That's fine. And how about the people that you're visiting in home, that the girls that are going out your aides, do they find that there's much flu out there?
They are finding that people are, well, a lot of times we're called in because there are colds and flus going around and people are recovering from them.
Mm-hmm. Do you think that the children bring home a lot of these germs? It seems like children.
The
just-
little children or
they
the
just-
adult, I think anyone who's out in public,
Or these daycare places.
I think anywhere you are that they're not I think it's hard to narrow down.
Yeah.
I think we're all exposed to so many people at so many places that it's very difficult to narrow down.
I know I go so many places, and I think I'm so blessed so far, you know, that I've been able to stay away from that. Of course, I had a flu shot too.
And that does help minimize the risk. So that's the time where people, I believe, are getting it, but not as severely. I know one woman who chose not to get the flu shot. She's not a resident at Chestnut Knoll, although people make different decisions everywhere. And she really got the flu. And they tested her and said, yes, this is indeed a case of the flu. And it took her down, and she's a healthy working woman for well over a week.
Really?
Yes, and she went into it completely healthy with no other illness as a woman probably in her 50s only. So
Wow. Well, I wish her well anyway. It's a shame when you get sick. I don't like that.
No, and you're taking good precaution not to. I mean, it really isn't willy-nilly about whether we get sick or not with these germs. We can do a lot to help ourselves.
It's strange because younger folks, younger than we are, I am anyway, you're younger, they never feel that they're going to have anything happen to them, that they're never going to grow old, that they're just going to go along, sail along at that area of life, and it just doesn't happen. I wonder how we could get through to them that it's not going to happen. Prepare yourself. Take care of yourself.
I think education like this, I think that people, teachers who work in schools and healthcare providers who work with sick people get the idea pretty early on. I remember when I first went into this work, I was very sick with everything under the sun for the first year or two. And teachers share these stories too when they get their first classroom assignment, because you're exposed to so many germs that you didn't know of before. So I think younger teachers and healthcare professionals understand, because it often affects us and we build up immunities over the years as we work in it. But certainly for those who don't work with ill people or with children who tend to be more, spread illnesses more, yeah, it's just realizing that, you know, it can happen to anyone.
At any time.
Absolutely.
It's amazing, isn't it?
Oh, it's absolutely amazing.
I think it's denial. I like to be 35. I'll always be 35. I like being 40. I'll always be 45. It's just denial. But it's part of life. Embrace it. It's wonderful to go through these steps of life. I mean, first we crawl, then we walk.
Have you always thought that, Dean?
I think so.
Really?
I think
there wasn't one birthday that you were devastated by or thought, oh my goodness, at 30 or 40 or,
no.
Well, you've not to 50 yet, so you can let me know.
No, I don't think I went there. The one birthday that I realized that, hey, you know, something else is going to happen in my life because I'm not 35, is when I was 60.
Okay.
When I was 60, that was a big thing for me for some reason. I thought, gee, I'm 60. Oh, my. You know, that's something else. And I remember when I was 50, one of the children that I was teaching at the time said to me, oh, you're as old as Disney, as what's his name? Mickey Mouse. You're as old as Mickey Mouse, because Mickey Mouse, I guess, was the 50th anniversary or something at the time. I don't know. And I didn't think anything of it. You know, I was going full speed ahead. I was going full speed ahead after 60, after 65. I'm still going
You're
full
still
speed.
going full speed ahead
Absolutely.
after a stroke, for goodness sake.
Full speed ahead.
That's right.
But it wasn't till I was 60 that I realized, hey, you know, it's going to take downtime now. It's downhill. So, but I didn't worry about the slide. I sort of like slowed that slide up. You know, some people go whoop, but I decided to take the slow ride down.
Well, and that's what you're a great role model for, Dean, is for making the decision and choice. It's a lot of it is mindset. I work with residents, I've worked with people for years now, from people in their 50s that are afflicted with dementia or Alzheimer's disease to people who are 104. And so I often say I've met some very old 60-year-olds and some very young 100-year-olds.
Yeah.
That if you would look at their behavior and actions, you wouldn't know their age.
I think that a lot of things are inherited, but I also feel that your attitude is something that you must work on.
That's right.
Because it's just like I use my brain as much as I possibly can, so that I think that will keep my brain going. It's like an exercise. The more you walk, the more you can walk.
That's right.
You know, like if you become a couch potato, you won't be able to walk.
That's right. And if you make the decision to get back up, you have to give yourself time to get going again, but you can do it.
That's right.
People don't look at their brain like they look at their heart, and yet it's a major organ in their body like any other.
That's the one that tells you, you can do this, you can do this, you can do this.
That's right, and self-talk works.
Yeah. It's self-taught. You are self-taught. I mean, like when I did that computer, it was all self-taught.
That's right. And you decided not to be afraid of it and to just put one foot in front of the other. And
I got angry. That's good. That's a good point. That's when you're getting well. Did you know that?
No.
First you get sick. Then you cry. because you're sick. Then you get angry because you're sick. Then you get well.
Really? It's like the stages of grief.
You have to get angry. I'm not going to take this.
Good.
You have to get angry. I'm going to change this. I can change this. If I can't change this, I'll find a way to change this. I think that's what you have to do.
Or I'll change the way I think about it.
Yeah, one thing or the other. You know, change the color of your hair. Do something.
Yes, absolutely. And we do have that control. Each person does.
Yeah. I know sometimes when I do things at home and I'm working on something and it won't work and it won't work for me, it won't work. And I even said out loud, now I'm getting angry.
Uh-huh.
But then I leave it for a while, for a couple of hours, and I go back.
And it works immediately.
And it works. Yeah, I mean, you have to play games with yourself. That's what you have to do. You have to play games with yourself. I don't think that my mother never grew old.
Is that right?
No, she never. She was always a little girl, even at age 95.
Really? Because she was playful, or?
Yeah, she was playful. She was cheerful. She whistled. She smiled.
And she was ill. She got ill. It wasn't because she was in perfect health till she was 95.
No, but it always was there.
How about that?
So I guess you're doing here. But she told me about how attitude should work. Don't get down. You know, if you break a dish because it's a dish that is part of a set, God forbid, huh?
Right.
No problem. No one hurt and no one died. We're all fine.
Put it all in perspective.
Yes. And boy, you don't do that when you're younger, but you do pick up on that when you get older, I think.
Some people do.
Yeah.
The people who have more peaceful existences do.
Oh, really?
It really gives you more peace.
Well, you know, it's strange I brought that up because my mother had a special set of dishes and it was gold rimmed. So what did I do? I went in the micro with it and boom, 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 you know.
And you had fireworks?
So this was a complete set. Oh, my mother's dishes. And I didn't get upset. I opened the door and I said, well, Mother, no problem. No one hurt.
That was after she passed this out?
Yeah, it was a couple weeks ago. No one hurt. I understand you understand this. And I just went, I use it.
What a great example and a great legacy to her.
Yeah, I mean, that would be fine. It's just a dish. It's not a person. It's not your soul. It's a dish.
I think that's where the book called Don't Sweat the Small Stuff.
Oh, really?
Kind of. There's a book called Don't Sweat the Small Stuff, and I think that's an example of teaching don't sweat the small stuff.
There you go.
And in the scheme of things, a dish is the small stuff.
So instead of a perfect set for 7, I have a perfect set for 6.
That's right.
So I can take this other set and
play around with it.
Put them in the micro.
That's right.
And then I'll have an original micro set.
That's right, in pieces. You can do a mosaic with the other set.
There you go. Oh,
Absolutely.
I got you off track a little bit here.
Oh, no, that's okay.
Okay, now let's hear about some of the things that are going to happen over there at Chestnut Knoll.
Well, our home care is having their monthly lunch and shop. So we pick people up at their homes if they're unable to drive or get to our Gilbertsville home care office. Our bus, our handicapped accessible bus, will come to your home and pick you up, bring you to the home care office to have a nice hot lunch, and then take you to the mall for 4 hours so that you can just either enjoy being out or do some shopping or just something a little bit different. And then either bring you back to the home care office if you've driven there yourself and left your car there, or take you back to your home.
Isn't that nice? And when is that going to be?
On Wednesday, next Wednesday, the 23rd, from 12 to 4, and you just call the home care office to make a reservation.
Oh, that'll be nice. A lot of people that can't get out, you're going to go to their home.
We do
and
go
if
to
they
their
don't
home.
have they're for the people that no longer drive. Isn't that nice, Jody?
It is.
You
Well,
don't drive, call, go for the ride.
That's right. That's right. And there's no fee, and we give you $10 to spend at the mall as well.
Oh, there you go.
So it just gives you an opportunity to get out and enjoy.
Okay, what else is going on over there?
On the last day of the month, January the 31st, we have Greshville Night. Chestnut Knoll is at Greshville Night, and I will be there, and a lot of the staff will be there. And are you going to be there, Dean?
I certainly am going to be there.
Excellent. So
And
come
we're
and
gonna-
meet Dean live in person.
Yes, here we'll be over there. I love to go over there at Greshville.
So
I go over there
Greshville-
quite often.
They have great food.
Great food.
And great prices on their great food.
Yes, not only that, but they have a nice staff over there, very friendly.
Isn't that the truth? We go there for meetings sometimes and they know us all by name. And isn't that fun?
That's right.
You know, I never thought of what that would mean, but it really means something when
Yeah.
they know what you like to eat or drink and
Yeah.
will bring it to you.
That's nice.
So Greshville is on Route 562, right outside of Boyertown, and this is our fundraiser for our Relay for Life team. So we are involved with Boyertown's Relay for Life to fight cancer, and this is a fundraiser we're having. So from 4 p.m. to 10 p.m., Greshville is donating part of the proceeds of everything they sell, people buy, drinks and food, to our Relay for Life team. And we hope to get a lot of people out there. So it's a Thursday night. I'll be there the entire time. People could come and meet you, Dean, and Harry too. And we'll have fun.
Yeah, Harry's going to take some snapshots for you.
Is he?
So
well, I'll mind myself then. If it's gonna
We're going to put that one on with the crown.
Oh no!
Well,
yes.
you know, I think that a lot of people that have never been to Greshville should give it a try.
Oh, absolutely. Or if they've been there in the past and
Yeah.
you know not had as good of an experience, come back again because it's terrific.
It is. I go over there and I like it. And say hi to Kevin.
Yeah, and you know what else? You get coupons from Greshville, Dean.
I know.
You get a member's card and they give you coupons for when you eat there and get nice discounts.
There you go. There you go. I just went over on a discount.
See?
See that?
Yep.
We'll see you over there.
Good.
We'll see you at
See you on the
Greshville
31st, yep.
On the 31st. Look for us. We're great ladies. You'll love to meet us. We're fun.
We are.
We're fun.
Even if it's not at Greshville. That's right.
Anywhere.
That's right.
Okay. Now, is there anything else special you'd like to say today?
No, just people should stay well. They should follow good hand washing, good infection control all of the time. Take good care of themselves, get enough rest, and drink enough fluids, and everyone will get through this epidemic, I guess it's been called, that we're having.
And if you need some information about an assisted living facility, please call Jody. She'll be glad to sit down and talk with you, give you a tour, tell you all about it. Very active community over there, believe me. I don't think I could keep up with them myself. She's always someplace doing something. Okay, now I want to tell you about Aging and Adult Services. Regardless of a household's income level, the 52 area agencies on aging fund and deliver aging services in every county of the state of Pennsylvania. They are where the aging population can turn for information when they have questions such as where to find a senior center, or maybe they need services for themselves, their families. They are offered information for referrals, for assistance in finding health care, housing work, food, and in finding companionship and safety. Why? Because the area agencies on aging have the resources available to assist them. So get to know your local agency on aging. Contact them soon. Now, did you know that when you give of yourself, you truly give? Give of yourself. You will feel so good. Till next time, be well, be happy, keep moving forward, and keep good thoughts. See you later. Thanks for watching.
Bring me sunshine in your smile. Bring me laughter all the while. In this world where we live, there should be